everybody. Welcome to the County Seat. I'm Chad Booth, your host. We are going to take a look on our County Seat episode this week at kind of a taboo thing that may make people uncomfortable, but it's a conversation that really is important to have, and that is STDs, sexually transmitted diseases. And people might think, well, what impact does this have on county government? Well, actually, as our show will outline today, it is a pretty big impact, and if it's not kept in check, it could become a serious and huge problem, and that is the course of our conversation. This is all based on a recent report on sexually transmitted diseases, and it was a survey done over a 10-year period to try and see what the trends were. We will start by getting a little bit better understanding of that report.
In the last 10 years, there's been a significant increase in STDs in not just central Utah, but within the state of Utah. We had a report done at our last nursing director meeting with the information of statistics, and the rise is incredible that we're seeing with these diseases.
As of 2017, rates of chlamydia, gonorrhea, and syphilis are at a 10-year high here in Utah, as reported by the State Health Department in a recent report looking at sexually transmitted diseases and infections over the past decade. 10,135 cases of chlamydia were reported in Utah in 2017. Two-thirds of those cases were among people between the ages of 15 and 24 years of age. Chlamydia is the most frequently reported communicable disease in Utah and the U.S. Gonorrhea ranked second for the most frequently reported communicable disease in Utah, with 2,541 reported cases statewide in 2017. More than 60% of the cases reported that year were among people between the ages of 20 and 34 years of age. These numbers have prompted a conversation among public health officials who see these trends as troubling and needing to be addressed immediately. The obvious solution being to target the populations most at risk. But it's not quite that simple.
The best target place would be our schools, catching these kids before they become sexually active and getting the education out there. There's a limited amount of information that we can share with them. You know, if this conversation was at home with their parents and their parents were educating them and talking to them about the risks that come along with being sexually active.
The topic of sexually transmitted diseases isn't being talked about at home, or is often glossed over. Many of us don't have the first clue of how to go about talking to our kids, or anyone about it. But there are resources at the county health department so you don't have to go it alone. Or worse, skip the conversation altogether.
Have those conversations because they will listen to you. They may not want to hear it from you, but if you are knowledgeable on those subjects, then you can come across more as a parent and as an expert than just somebody that's so outdated and doesn't understand. But we need to let kids know that there are major, major consequences.
That is something that we're trying to change, that stigma, that you really do, like Jamie said, education is knowledge. Like, honestly, go get yourself educated. Go to the CDC websites, go to the health department websites. There's several places out there to educate yourself about communicable diseases and how they're transmitted.
Educating people, particularly young people, is more important today than it's ever been before, because now the ability to find partners is literally at a person's fingertips.
With social media and the trends that we are seeing, the apps that students and even college students are on, there is a culture of promoting risky behavior. And we want to get the message out that that is not the case. There are consequences for sexual behaviors, and you need to know those if you choose to take on that activity. And so we try to promote education and knowledge. Knowledge to me is power. In our community where Utah is a deeply religious state. I really believe that science and religion can merge on this subject really well. And I think knowledge is power. I want parents to talk to their students about consequences and let them know, that STDs are on the rise. And having that conversation, I feel like as student nurses, we get to have that conversation, and it's very important that students have that knowledge ahead of time because they feel very bulletproof, in those late teen years.
For the county seat, I'm Derek Dowsett.
We will continue our conversation going from the point of the report forward and interpreting some of its contents and looking into the crystal ball of the future when we come back on the county seat.
There are meetings, and then there are gatherings. At the Davis Conference Center, we know the difference. Turn your event into something more than just another business summit. With over 70,000 square feet of flexible meeting space, state-of-the-art presentation amenities, and inspiring architecture, the Davis Conference Center is designed to deliver stellar results in a majestic setting. Take your convention to the next level. Schedule now at davisconferencecenter.com.
149 million years in the making, dinosaurs once roamed this land. Now they're found at the Dinosaur National Monument. Let's take you beyond the bones. We call it Dinosaur Land. You'll find it offers adventures and sights not seen anywhere else in the world. Come to Dinosaur Land, Vernal, Utah. You'll want to stay forever. The dinosaurs did.
In a place that is beyond words, there is nothing to be said, except take your time in Bryce Canyon country.
Welcome back to the county seat. Our topic today, sexually transmitted diseases, and a report or a survey that has been conducted over a long period of time, giving a historical analysis. Joining us for the conversation is Carmen Drury, who is an epidemiologist for the Utah Department of Health. Carmen, thank you for joining us.
Thank you for having me.
And Clint Painter, who is commissioner from Juab County and the former chairman of the Central Utah Board of Health. Clint, thank you for joining us, and thank you for all your input at bringing this episode together. Appreciate it.
Oh, you're welcome. I appreciate you being willing to take the chance on this episode.
So, you know, there will probably be some people a little squirmy about this conversation, but it is a realistic problem, and it does have implications. As I have just kind of perused through this report, Carmen, I just see a whole bunch of stuff here that really surprises me. Can we start with just a basic overview of maybe why you think that the expression of these different sexually transmitted diseases is so disparate and different? Because there's no similarity, and one seems to be like a boy disease, one a girl disease. What attributes all that?
Yes, so this report was compiled over the last 10 years, as you mentioned, and we collect those cases here at the Utah Department of Health in Salt Lake City, and because they are nationally notifiable, so that means that they have serious health consequences such as infertility, pelvic inflammatory disease, etc. And we do see varying rates by county, and that's what causes some of the disparate trends you mentioned. Those are attributed to population size, and depending on the sexually transmitted disease, we see a higher incidence among females or a higher incidence among males. So one reason for that is the three diseases we are talking about are chlamydia, syphilis, and gonorrhea. Mm-hmm. And with chlamydia, we do see the ratio among females twice that of males. Now, the reason for that is because there's an annual screening recommendation. And that is to detect for these adverse health consequences such as infertility and pelvic inflammatory disease. So women are screened annually so that they don't become pregnant and have a sexually transmitted disease.
On the other hand, it looks like gonorrhea was just exactly the opposite, and it was much more reportable in men. So for the most part, and I'm not trying to be categorically excluding, but for the most part, doesn't it take two to tango? And so I'm not quite sure why the disparity is taking place. It seems to me that there should be just as many cases of both. How come that gonorrhea ended up being so much higher in men?
Exactly. So with gonorrhea, that is an STD that we see, and it predominantly affects our men who have sex with men population. And it is symptomatic, so that means that when males have it, they are going to notice. They're going to notice symptoms and some, unpleasant symptoms such as discharge and things that will bring them into medical care. and that disease will be detected. So that is largely why we see more gonorrhea in males than in females. Among females, gonorrhea is largely asymptomatic, so no symptoms. You might not even know that you have this disease.
So, Clint, are you surprised at how widespread this has become? If in rural Utah, I don't think anybody that's watching this show thinks, well, this is a rural issue. They think, okay, this is all like an urban thing.
Right. But you know, it's actually has become quite a. It's actually a big surprise to us. We meet as the Board of Health, every other month, and we're given a one of these reports each month by our nurse, and we look at them, we turn to them, and it just surprises me that it's still an issue. I guess for years growing up, you've heard about take care of it, make certain that you're safe, and so just to see that the numbers are on the incline is very surprising. And I think I'd mentioned once before to you, Chad, that I think what really surprised me was that syphilis is still around. I mean, I thought 30 years ago it was all but eradicated.
And it was largely on the decline then, but nationwide we've seen an increase in syphilis, and there are several factors for that. I think maybe some barriers in rural Utah are that there's a stigma around it. It makes people uncomfortable, and it really is largely up to parents and providers in those settings to talk to people about getting screened for sexually transmitted diseases.
So do you think that part of it is that we're overcoming the stigmas and the reporting is going up, or there's better reporting, or do you think there's actually just more of the little bacteria floating around out there?
So I do think the stigma is still an issue, largely nationwide, especially in rural areas, just because everyone knows everybody. You might be more hesitant to go into retail stores and purchase things that will prevent that transmission, so condoms. And then as you mentioned, yes, reporting has increased. So we have a communicable disease law here in Utah that mandates providers and laboratories to report a disease.
Well, I'm thinking back to when I was young. It seems to me that there was mandatory reporting even back in the 70s, is there not? Was that not the case, or did that stop at a county level, or or did just doctors not report it?
Yes, back then I believe there was not a rule in place that mandated it by law. So now it is a law that is required. If a provider does not report one of these 3 sexually transmitted diseases I mentioned, then we need to contact them and educate them on the importance of reporting that.
Okay, very good. I think it's a good place to take a quick break. We'll come back with the county seat and pick up our conversation right after this break.
In our world, the sun shines on high adventure, and new experiences are yours for the taking. And everything in you looking to play outside the box. Cedar City, it's time to play.
Utah has a national treasure where winding canyons stretch to the horizon, where nature forms elegant structures, and where iconic monuments of the West stand tall. Visitors around the world come to get a glimpse of southern Utah's legendary landscape and landmarks. Join them and explore San Juan County, Utah's Canyon Country.
Welcome back to the county seat. We're talking about sexually transmitted diseases and a surprising report that shows a rather significant and steady climb in the reported cases over the last 10 years in age groups that you may not think would even be on the incline. I do want to focus for a minute on reporting, because we've talked about reporting techniques maybe making a little bit of the difference in the reported number of cases. How does that function work? I mean, obviously the county has to report to the state. How do people report to the county?
Well, so what happens is when someone goes to any clinic and tests positive for one of the diseases that we've mentioned, that clinic has to report it to the state, to Carmen, and then that information is disseminated out to the counties. So, you know, if somebody in Nephi goes to a clinic even in Payson or Provo and is tested and it says this is, you know, my address is in Nephi, that information still comes back to the Juab County health nurse. And so she will follow up from that point to make certain that the patient or the diagnosis has been treated, and then follows up with them to find out about their partners and if they've notified their partners or if she has to notify their partners. And they ask about their partners for the last 3 months.
So I guess that's a question. One, you know, people would probably think, okay, I live in Nephi, I'm going to go to Salt Lake so nobody knows me. I'm going to go to a clinic, get tested, get treated, and then nobody will be the wiser, and I'll be past this embarrassing scourge when I go back to Nephi. But obviously it doesn't work that way, and you can't keep it quiet. Is that about sum it up?
That is a good point. Yes, people can go anywhere to be tested, and then what will happen is, based on their address, after it is reported to the state, it is sent to that health jurisdiction that they live in. So that's very true.
Okay. So is that really an important part of it? Because it seems to me that might discourage some people from going to get treated if they know it's going to get back to their health nurse and somebody's going to come. We have to talk about a few things. I mean,
it will go to that health department and that health nurse, but that's only one person. That's not exactly their personal provider that they interact with on a variety of other health issues and screenings.
True, but they are going to have to, I mean, the goal of all this is to catch other people who may have been exposed to the disease, and so with that comes the fact that, well, you're going to have to fess up everything. Is that not correct?
So the goal is to find partners and treat them so we can eliminate the spread of that disease. But at the same time, if someone does not disclose their partners, there's nothing we can do about that. And with dating apps and anonymous sex apps, oftentimes people don't know their partners. They don't have that information to give. Now you should want to report your partners just so that you care about their health and you care that they get treated. That's really the point in partner services.
Clint, have you talked to your public health nurse in Juab County about how hard it is to get this information from people who have been reported?
I have. You know, I was talking to her, and she does a fantastic job. She said that a lot of times when people call, they feel like she's being nosy. The truth is she's not being nosy. She's just trying to make certain that everyone that may have been infected is treated. We just want a positive outcome for everyone that has the potential of being infected with it. And so sometimes the questions may seem a little intrusive, but they still are just trying to get to the, all the necessary information needed, I guess.
And we are very thankful for our public health nurses who do that investigative process and reach out to people, make those uncomfortable calls and ask those hard questions, because at the end of the day, they are just trying to take care of people, and all of that information is completely confidential. So only that person being notified knows.
Okay, even within the confines of this show, we've had 3 episodes over the 9 years we've been on the air about grandma. Are these records protected from grandma?
They should be protected by from grandma because the HIPAA will actually
will supersede
grandma.
Okay.
Right.
I mean, these are questions that people are going to have and are going to want to know about. It's like, do I even want to report this? Do I even want to go to a doctor? Because my biggest fear is that people won't report it. And so that leads to the next question. What should people know about what happens in any case, chlamydia, gonorrhea, or primary or secondary syphilis? If you don't get it treated, what happens?
So very, very serious health consequences. If you notice, we're not talking about other sexually transmitted diseases such as human papillomavirus or herpes simplex virus. These three in particular are so stressed because of their consequences. So as I mentioned earlier, if a male or a female has chlamydia, they can both become infertile, so not be able to have kids if they are not treated for chlamydia. The same with gonorrhea. Gonorrhea also has the consequence of becoming disseminated and becoming a systemic infection. Syphilis was very terrible. We know that it can cause, at any point that you become infected, you can have neurological effects. So
I understand it can actually drive you to insanity. It can create blindness.
Yes.
So some very serious kinds of people.
Hearing loss.
Yeah. What are your concern because people may not report it? What do you think the problem will be, going forward if you don't address it?
Well, I think we have a couple of different issues here. One of them, for instance, we have a projection for our county to grow. The state's projected saying Juab County is going to be over 50,000 people by the year 2060.
Where are you at right now?
We're just over 11,000. Okay. So we've still got quite a big, gap to get there. But that's what they're projecting, and it's just going to continue to compound. If it doesn't start declining now, I can see, you've got a 5 times increase, over the next 30, 40 years. What kind of increase are we going to see in these diseases if they're not being stemmed or stopped now?
Yeah, but if somebody were to read this report, though, they would look at it and they would go, okay, I'm looking at the percentages here on a per 100,000 basis, which is how this entire report is built. There's only one of them that actually exceeds 1%, and that is, I believe, females in an age category with chlamydia, and it's just barely above 2%. And if you look at it as, if you're looking at it like the flu, a 2% chance of catching the flu, somebody may not go get a flu shot. And so why is it so important to keep this suppressed so low?
Well, it is so important because of those health consequences. We don't want infertility among people. The economic costs are large, and you mentioned the economic costs. In addition to the medical costs for treating of it, you're also looking at the business cost. People are missing days of work because of it, because they're sick from these diseases, so they have to take time off of work. So we have an economic loss for that as well.
So you're an epidemiologist, Carmen. If we didn't make an attempt to treat this and keep it down low, how long would it take until those percentage numbers started to blossom like bacteria in a petri dish?
Yes, they can become exponentially greater. So many factors. Everyone has sexual encounters, and there can become sexual networks. There's just all these elements with sexually transmitted diseases, like multiple sex partners these days, and the anonymous sex apps, and just the convenience of it all these days. It could really blow out of proportion.
Okay, we're going to take one more break. We'll come back. We'll pick it up with some of these very questions, a little bit more oriented towards the report and what the perhaps causes and cures are. We'll be right back on the County Seat.
My daughter and I had just finished a run at this place called Eagle Point. It's this really cool but kind of challenging ski resort that has a real family feel to it. She was so excited because she beat me down the run. Deja vu. I saw myself as a kid out skiing my mom. It was a big moment for me. And all of a sudden it hit me. I was making the same memories for her.
Beaver County, Utah. Make it more than a vacation.
There's a little place on a Utah map where I was raised, where my heart's at, where the sagebrush grows wild and high, and the stars come out at night. Oh, there ain't nothing like being raised in the basin with a Ute reservation, skiing starvation, that Duchesne County life.
Welcome back to the county seat. We don't have a lot of time left in the show, and there are a lot of interesting questions. So, Carmen, I'm going to ask you this statistical survey and report. Is this general reading?
So it is a difficult read because of the figures and the statistics involved in it, but I definitely recommend that anyone read it in the state to get an idea of the magnitude, and that this does affect everyone in every single county of all age groups. And that can be found on the Utah Department of Health's STD reports website, and you can simply Google that.
Okay, very good. Clint, we've maybe got some people thinking out there in rural Utah, and I know you can't speak for every county or every county, multi-county health agency, but if people want to know a little bit about this, how do they start?
Well, go to your local public health department. You know, the departments are small, and they have great people that want to help you. You know, they have resources. They have free condoms. They offer cervical screenings. As you mentioned, they offer family planning. If you feel like you've got a, you know, maybe you have an STD, and you're afraid to go to a clinic, you can go there, very confidential, very private. They can test you for a very low cost, and they can test you and treat you right there, all in the same place. And so, it's a great resource to have, or to be able to utilize to help you overcome.
I guess the last question for a short answer, is it better to face the embarrassment of bringing somebody else in and having to contact partners and say, well, this happened, I'm not sure exactly how, but you know, somebody's got to fess up. Is that a better option than just ignoring it and plowing on with your life?
Certainly, yes. I would advocate for bringing in your partners, or having those contacts, that information, so that they can be contacted.
You know, this is a disease that it impacts. You know, can impact individuals, families. You know, sometimes it, you know, may alter the course of a family. But you know, it's a community. It's cultural. And it's one of those things that really needs to be addressed. You need to, you know, we need to put a stop in it somewhere.
I guess in summary, an ounce of prevention is worth a pound of cure, and we're not talking just about the disease itself, but all of the consequences of it. Thank you for bringing this to our attention, and thank you for tuning in. And for those of you who are still here and didn't go away blushing, share this with your friends, not the information. And we'll see you next week on the County Seat.